Hello, my name is Dean, and today I'm going to talk about schizophrenia and the diagnosis and some of the statistics. First, I'll start with the statistics. The U.S. population is pretty high, as you know, but the amount of people that have schizophrenia in the United States is about 1% of the population. Um, in that percentage, about 7% of the people that are suffering with this disorder commit suicide. So we have things in place to try to stop that factor. We are seeing right now that a lot of people with schizophrenia, they actually are getting in criminal trouble rather than being in hospitals where they can get help. Right now, that's a fault in our system, but we are working towards that not happening any longer. Currently, the relapse of schizophrenia is about 80% of those who have sought treatment, and that is due to people not taking their medication, which the statistics of that would be around 50% of people with schizophrenia. They no longer take their medications and such because anything can possibly get them to stop taking their medication. Either voices in their head saying that it's a bad thing, or they don't have the right medical insurance and things like that. So the DSM-4 is a bit different than the current DSM that we have right now, which is the DSM-5. In the DSM-5, we've changed a little bit with schizophrenia, and that is DSM-5, we added the word spectrum for schizophrenia. And the reason we did this is because there isn't just one form of schizophrenia, there are different stages. So there could be a very low stage, say stage 1 of schizophrenia, and a very high stage, stage 5 of schizophrenia. So that is one step forward to finding out how to cure this disorder, also to treat this disorder, because if we know at what stage we need to catch it, that will help us become more adept to this disorder and the people suffering from it. And in the 20th century, a man by the last name Bleuler, he coined the term schizophrenia, and I'll tell you why this is important. In the 19th century, we believed that schizophrenia was a form of pre-dementia. Obviously, we know now in the 21st century that that is not the cause of schizophrenia. Though dementia and schizophrenia may have some things alike, explanation of insanity and others, they are two separate disorders, and through treatments and other things, we have decided that that is no longer the case. Also, as you can probably tell, schizophrenia is a disease of the brain, and so we have to look towards the brain to try to figure out how we can treat this disease. So an amygdala, which is a part of the brain, we've studied that for schizophrenia patients because the amygdala on the left side, we see in some patients, not all, but the majority of patients, we see on the left side of the amygdala more dopamine. So that is something that we look forward to researching more, and we can tell if there are certain triggers that would cause this. Schizophrenia can be caused by many things. It can be genetic, environmental, substance use such as LSD can cause schizophrenia. Hallucinations and delusions, those two things alone are enough to diagnose somebody with schizophrenia. There are multiple other things that come along with schizophrenia, but those are two things that we definitely can say, okay, we need to take a closer look at that. So, and obviously different cultures may diagnose this disease a little bit differently because the way that we view things isn't always the way others view things. So, schizophrenia is not just in the United States, though in some cultures or countries, we may see that schizophrenia is being called something different. But overall, schizophrenia affects men and women equally. So, we have to look towards that, and we need to treat them equally in this disorder. Um, so, another thing is the right balance of receptor blockage and dopamine release. That is something that people without schizophrenia have, and scientists and psychologists are working to find out how we can create that balance in people who do suffer from this disorder. And like I said, really, schizophrenia, we are still on a road to find out more about the diagnosis factors of this disorder, and the statistics are being thrown at us, but it's very hard to find schizophrenia patients whenever they no longer receive treatment. Um, and so every step forward we take, we are getting closer to figuring out that we have to look at the brain, we have to do MRI scans, RMRI, and other things like that that can see what the brain is doing inside the head, and then possibly we can figure out what schizophrenia is completely and how we can stop it from the very first time we see it. Um, I hope that this video was informative for you, and I thank you for watching. I hope you have a really great day.